Hey everyone, it's Dr. Hodges, and I want to show y'all really quick how to use some scar tape. I have a lot of patients that will ask me about scarring after surgery, and certainly doing these procedures laparoscopically, you just get little tiny incisions. And folks will always ask me, hey, is there anything that I can do to help to reduce the size of my scars? So I think the first couple of things is you always want to make sure that your wounds stay nice and clean. If you have a wound that gets infected, there is a risk that you can have more scarring because you won't have really good proper healing and the tissue edges might not come together so well. So you could certainly have an issue with increased scarring if you have a wound that gets infected. So keeping up with hygiene. And what you need to do for that? Good old-fashioned soap and water. You don't need anything special on those incisions. Don't put hydrogen peroxide. Don't put betadine. Don't put neosporin. Soap, water, pat it dry. So that's number one. Number two, I know if you are prone to keloiding or a hypertrophic scar, that just means is whenever if you get a cut and you get a scar, it gets really big. That's really just, it's almost like an autoimmune reaction. Sometimes your surgeons can inject a little bit of steroid. There is always a risk though, whenever you have steroid injected into that wound, that again, you won't have proper healing. And in my career, whenever I've had somebody that's keloided and I do use steroid, knock on wood, only one time have I had that wound really not heal from the steroid, because by default, what steroids do is they suppress the immune system so you just don't heal as well. But let me kind of show you something that you can do to really help with scarring. So what you have right here are just some silicone scar sheets. I got these off of Amazon. This one comes in a roll, but they come in all different colors. They come pre-cut, but I got the least expensive. It's a medical grade scar tape. I think that this was probably about $20. They do have some online. There's that are name brand, but honestly, you just need the silicone scar sheets. These have been shown to clinically decrease the risk for scarring, and typically you can start to use these scar sheets once the scab has fallen off your wound. So when I have my roll, sometimes they come pre-perforated. This one is not perforated. I just cut a little piece off. And do you see how there's an edge you can peel off like that? Now, my sweet husband is my guinea pig. You can see that he just had a procedure done. He had to have a little skin cancer removed. And he's healing very well. This is more of like a little bit of a bruise, not necessarily a scab. And what I'm going to do is just put this right over. Now that's kind of big, but this is just for demonstration purposes. I just want to show you guys how to put this on. Now, and that's literally all you do. Now, typically, if you have a scar on the face, they actually have silicone gels that you can keep on the wound to act as an occlusive dressing. For my husband, we're just using a little piece of scar tape. He's a man, so you know. But you can use a scar gel. When you have the scar tape over a wound, you really want to keep it on. I mean, for the majority of the day. Literally, you just take it off at night when you're going to take your shower. Soap, water, pat the wounds dry, and then put a new one on. And the recommendation is for you to keep it dressed, and you want to use these strips for the next 3 to 4 months. It can actually take up to a year for a wound to remodel. Usually that long line, your little incision, it will be red or pink. That is normal. It's going to be like that for several months. And it's not till it really becomes kind of more flesh tone will you know that it's completely remodeled. But again, that usually takes 9 to 12 months for it to be fully remodeled. certainly if you have an incision like he does on his face, it's going to be really important that once he's no longer wearing the scar tape, that he's using sunblock on his face. If you have scars on your abdomen, if they're going to be out in the sun, you need to make sure that they're also covered, because I will tell you, while it's in that remodeling stage, the sun can cause discoloration. So that's why it's really important, if you have a scar on your face or on your neck or on a part of your body that's really exposed, or maybe like on your chest, something like that, you need to make sure that you're using like 10,000 SPF or you're keeping it covered. Otherwise, you do risk discoloration that's permanent to that scar. I think one other thing to note is that after the scar is healed, if you have a raised scar, you can always be seen by plastic surgery, and they can always do, or dermatology, they can do some dermabrasion on a scar. They can also inject that scar once the edges are really nice and healed. They can always try to inject it with some steroid to also decrease any further scarring, especially if it looks like it's becoming a keloid or it's becoming hypertrophic. But anyway, this is the way to go. 20 bucks. It's a really easy way to really help with healing. I had never really heard of silicone scar tape, and it was actually one of my patients. She had lost, over 100 pounds, and she went for a complete makeover. She had a breast reduction and breast lift. She had a tummy tuck, and she had her arms done. And she showed me her incision just from her tummy tuck. Oh my gosh, it was like barely a little thin line. And she was olive complected, and she barely had any scarring, and I was sold. So silicone scar sheets, who'd have thunk? But really good, really cheap. Get these whenever you're getting all your protein and vitamins when you're getting ready for surgery, so that you already have them. Also, as a side note, if you're a lady and you're having a breast reduction, they actually make these pre-cut for the breast reduction scars. So they have some of these pre-cut already, depending on some of the surgery scars that you might have. So that's something to think about as well. So hope that this helped.